There's a tool that could help keep you out of the emergency room. So why aren't more communities using it? Fox 6 investigator Amanda St. Hilaire shows you the safety issue that's wrapped in red tape.
In an emergency, their job is to move fast. But before the emergency, West Allis firefighter Chris Williams' job is to take his time.
You're not rolling up with a big fire truck and an ambulance, you know, the bells and whistles going off. Alrighty.
Hello.
How are you?
Good.
Good to see you.
For patients like Jim and his wife Sandy,
he has Parkinson's-ism, water on the brain, dementia, diabetes, manic depressant. Should I continue on?
Yeah, thanks a lot.
that time with Chris,
I can't remember hardly anything.
it's more than a house call.
His legs were getting weaker, and one day they just stopped working. So when he would fall, being home alone, he would call the West Allis Fire Department. And after probably the third or fourth time of coming, within, I don't know, maybe 3 or 4 months, they start taking a look at the house.
So I'm just gonna do a home inspection if you don't mind.
There are lots of names for Chris's job. Usually it's called community EMS.
How you feeling, James?
To prevent 911 calls later, Chris does non-emergency visits now.
118 over 64. That is almost picture perfect. Let's talk a little bit about nutrition. When was his last fall? Do you have an avenue where you can take care of yourself? Any pertinent health care history that you want us to know about?
It's comforting. You get a new set of eyes to look at the house, look at the setup, and maybe reconfigure how you've done things.
My mom had MS when we were younger, and the fire department used to respond to her house and pick her up from the floor and put her back into her wheelchair or her bed on a consistent basis. My mom would have really benefited from a community paramedic approach.
Wisconsin EMS Association says more people like Chris could fill gaps in parts of the state that don't have easy hospital access. For example, federal data shows roughly 23% of heart failure patients end up back in the hospital within the next month. But that number dropped to just 8.1% for heart failure patients Aurora West Allis connected to community EMS.
That is the difference between life and death right there.
There's a push to do more, like using community EMS to get patients treatment for opioid addiction. But there's a holdup.
Wisconsin hasn't always been on the cutting edge.
State legislation was designed to make it easier to start community EMS programs, outlining training, protocols, and approval process. It took 5 years for that bill to finally become law in 2017. But more than 2 years later, it still hasn't actually happened. That's not unusual. The state is caught up in the rulemaking process, public comment, hearings, legislative review. Every law goes through this before going into effect.
Deep breath for me.
Until that's done,
Very good.
the jump start for community EMS in Wisconsin
One more.
stays wrapped in red tape. Another slowdown.
Currently, community EMS is not funded. So the regular models of Medicare, Medicaid, private pay insurance, they don't currently exist.
James, do you worry about falling?
So who pays?
Be more proactive.
In West Allis, patients don't get a bill. Some hospitals pick up part of the tab, but the rest is about taking the long view.
Less calls on the floor, less time that we're going to have to spend in the 911 mode, wear and tear in the vehicles, everything else. So that savings plays out in many different ways. It's very different mindsets, a very different focus than what people are used to.
Because keeping you out of the ER in the first place looks less like this
I love your Packer gloves.
and more
How do you feel about the loss?
like this.
Ah, man,
Tell me about it, right?
I knew it was coming.
Chris can't solve every problem in a 45-minute checkup, but he walks away knowing, at the very least, he's given his patients the gift of time. If you live somewhere that offers community EMS, there are several different ways to get that service to come to your home. Sometimes it's a referral from a hospital or a direct call to the fire department. We have more details about that on our website, fox6now.com. With the Fox 6 investigators, I'm Amanda St. Hilaire.